Tell us why at the agenda _SABC, and you're also welcome to send in a voice note on 084 8133 465. Now, amid concerns that COVID-19 vaccinations in South Africa are not going according to the set targets, the higher education and training sector is once again calling on students to get vaccinated. This as some universities have been contemplating mandatory vaccination for staff and students, and that those not vaccinated must undergo weekly testing at their own cost. The CEO of Higher Health, Professor Ramneek Ahluwalia, says it is too early to introduce mandatory vaccinations in higher learning institutions.
The question about mandatory vaccination at this stage, again, is a bit too early again for the higher education. And again, it's 1.5 months to what we have opened our vaccination to a population about 18. Still early. People are making time. We need to put those efforts still further, which comes into the reality of how we can still promote vaccination. That's exactly we are emphasizing. But even if we have to go on to, we don't call it mandatory as a word, called regulations on vaccination, then it has to be thoughtfully put in a very phased approach. Who is more at risk? For example, students in Faculty of Health Sciences. Predominantly why? Because they themselves can carry the virus and give it to the patients. Patients are extremely vulnerable. Patients can die because of the student risk, or vice versa. And similarly, then campuses with residences, so that living together. So I think there has to be regulations which will come at a stage when our maturity of vaccination program will grow gradually. At this moment, the data is worrying for us. We've only seen 1/3 of our students vaccinated. Those are 1/3 students who believed in vaccination, even stood in long queues when vaccines were brought into our campuses. So 1/3 of our population is vaccinated in higher education, if at least partially vaccinated and waiting for the second dose. The challenge now is the middle 1/3. And the last 1/3. The last 1/3 is the one which has made their decision and they're not budging down. But the middle 1/3 are still wanting to, and it's taking time. And that is the population that we are working, and the strategy is to push that middle 1/3 now. Because that middle 1/3 has made their mind, they start believing in science. They are not as influenced by the anti-vaxxers. They want some questions of answers like, our testicles increase? Whether we will have something called impotence, we will not be able to reproduce. And these are genuine questions. And interaction, bring science to them, peer-to-peer. And that is exactly where we are. And through you, we are appealing to this middle 1/3 to come in, also to the last 1/3. And when we reach that 2/3 of our population, and that is a decision we need to make, whether the last 1/3 will still get influenced by the bigger peers, or will we have no choice then to start looking at those regulations? We are fighting another world called social media, and people who just believe in writing what they feel like. And it's a freedom of thought that anybody can do. And that influences. So as much as you put as many efforts, they will always be diluted by a very strong social media presence. I always believe technology was invented for human advancements, but sometimes technology can be anti us. And that's another debate of a massive challenge we are fighting, irrespective of the number of resources. So what we've started is campaigns, campaigns on bringing vaccination on the campuses, specifically our rural and peri-urban areas, where we can't build vaccination sites into the system. And we've got about over 1,000 sites that we can bring easy access of vaccination on the sites, But the campaign is more around health and wellness. We do not want to forget our population on HIV and TBs and other pandemics like mental health and gender-based violence. So destigmatizing COVID while bringing it under the health and wellness umbrella. Peer-to-peer is our biggest hope. We have foot soldiers. We're just praying our foot soldiers. This model works for us. It worked for HIV. It worked when our COVID-19 outbreaks were happening. We had to test them in large numbers and isolate them. It did work. But we are still battling. Will this be a powerful tool to change the mind of getting the vaccine, which is a jab in your arm? And that is it.
And in this